let's continue with the rest of the CTVS questions. The next question is, a patient came with the symptoms of ptosis, enophthalmos, meiosis with radicular arm pain. Radiology revealed an apical lung mass. What are the nerves involved? Here, these typical features of ptosis, enophthalmos and meiosis, all these come under typical of Horner syndrome. Next, radiology also revealed an apical lung mass. What does this indicate? The examiner is typically pointing towards the Pancoast syndrome. What is a Pancoast syndrome? Patients who have local extension of lung cancer at the apex of the lung into the thoracic inlet will have the following features. Because of the involvement of the C8T1 nerve roots, they will be having pain in the arm, and because of the sympathetic nerve involvement, they will be having Horner syndrome, which is nothing but meiosis, ptosis, anhidrosis and enophthalmos. And typically the first, second, third ribs will also be involved, and occasionally there will also be paresthesias along the distribution of the ulnar nerve of the hand. So all these together point towards the diagnosis of Pancoast syndrome with involvement of C8 and T1 nerve roots. The next question is, a middle-aged man presents with chronic cough with expectoration, fever, weight loss and putrid sputum and anemia. I think the history was for at least 1 or 2 months, and he is also a chronic alcoholic. What is the diagnosis? Straight from the question itself, they have clearly mentioned a putrid sputum, which is very characteristic for lung abscess. They have also provided an X-ray. Actually, this was a bit given over here with a bit enlarged mediastinal lymph nodes. So it was typically showing a cavitary lesion. So in the Sabiston, they have clearly mentioned most of the lung abscess are due to anaerobic bacteria. They evolve over a period of weeks or months. The characteristics include fever, cough, sputum production, and along with this, they will have chronic systemic disease like night sweats, weight loss, and anemia. And a chest X-ray may also demonstrate infiltrates with a cavity, frequently seen in a segment that is in a dependent position. If it is in a recumbent position, it is a superior segment of a lower lobe or a posterior segment of the upper lobe, as it was given in our case. So the answer in this question will be a lung abscess.